So friends, let us start this third and last session on awareness training on COVID-19. So the session is on what to do if you are corona positive. So in this session, we will understand what steps and measures should be taken if someone is tested positive for coronavirus or COVID-19 disease. So let us see the measures that you should take if you are found corona positive. So in the tests, if it comes that you are corona positive, you have tested positive for the coronavirus, then number one, stay at home and put on a mask. A face mask should be worn all the time by you, even at home. Number two, isolate yourself from others at home. This is for the sake of other family members and people who come to your home. Number three, inform your close contacts that they may have been exposed to COVID-19 in previous 3 days. So this is very important as your close contacts who may have been exposed to COVID-19 in previous 3 days because of your close contact with you. Number four, ensure shared spaces, pets, and common objects. Ensure that such objects are sanitized twice daily. So all the common things like doorknobs or tabletops or other remote control or something like that which are used by other people in the home should be sanitized twice daily. Number five, use medications as advised by your healthcare provider or your doctor. Number six, keep in touch with your neighbors or friends via phone only. So it is important to get them know about your condition, about particularly if you are alone at home. So therefore you need to keep in touch with them so as to deal with any situation if your condition worsens or something like that. So keep in regular touch with them via phone or by messaging or by texting. Number seven, seek medical help if your condition is worsening. Call medical service provider, national or state COVID care helpline of your country or state. Number eight, in case of hospitalization, follow all the instructions or treatment which are provided by the doctor or medical team at the hospital. So once you are admitted, if condition worsens, you should go to hospital after contacting the emergency care helpline or national or state COVID care helpline. And after hospitalization, follow all the instructions and treatment given by the doctor and medical team. So these are the key measures that you should take if found corona positive. Now let us see home care for corona positive persons. What steps should be taken for home care, during home care of corona positive persons? So if you are at home and you are corona positive, maintain maximum possible hygiene. Get enough rest and stay hydrated. This is particularly important so as to contain the disease and get out of it. Number three, take nutritious food including fresh fruit, vegetables so as to boost your immunity so that to ward off the dangers of this disease. Number four, regular steam inhalation and gargle with warm water at least twice daily can help a lot. This has been found to be very effective in many people. So if you are corona positive and you are at home, you should regularly take steam and gargle with warm water at least twice daily. It will give you relief from symptoms of COVID-19 and also help you to recover fastly. So these are the home care for corona positive patients. Further, You should monitor your temperature and also your oxygen level using an oximeter, which is given as percentage SpO2. So you should monitor your oxygen level regularly as well as temperature using a thermometer. So this is very important. You should monitor at least twice your temperature as well as oxygen level if possible with a pulse oximeter, and stay in touch with your doctor and health worker. Inform them about your condition, your temperature, your oxygen level, so that they can decide what steps to be taken next. And be sure to get medical assistance or get hospitalized if you have trouble in breathing or have any other emergency warning signs. Or if you think it is an emergency, you must get medical assistance or get hospitalized as per advice of your health worker or doctor. So let us see what are the danger signs and when you should seek emergency medical care. So you should seek emergency medical care immediately if there is any danger signs. And what are the danger signs? Number one, trouble breathing, persistent pain or pressure in the chest, excessive weakness, confusion or sudden change in your mental status, inability to wake or stay awake, bluish lips or face. These are the signs of an imminent danger. So in such situation, you should seek emergency medical care immediately. And this list is not exhaustive. There may be other danger signs or emergency symptoms. So anything you find which is out of your condition, your out of your tolerance level, then immediately inform your medical care provider or your helpline number and seek emergency medical care immediately. Now let us see some do's and don'ts for corona positive person. So let us first discuss do's. What a corona positive person should do. Number one, a corona positive person must stay indoor. He must not go outside. He should stay in the home in isolated condition. Number two, wear a mask over your nose and mouth, like shown in this figure. You can see here the mask is covering the nose as well as the mouth, and it is properly fitted around the sides of your face. Cover your coughs and sneezes. You can use a tissue paper or you can sneeze in your elbow if needed. Clean your hands often, at least 3 times. It is a must to clean your hand with soap and water or hand sanitizer. And whenever you find something dirty on your hand or you feel that you want to wash your hand, you must wash your hands properly. The next is consult a doctor if you are sick. If you have your symptoms are worsening, consult your doctor. If you are feeling sick, consult your doctor. Wash your dishes, drinking glasses, cups, eating utensils, hand towels thoroughly after using them with soap and water or put it in the dishwasher. Clean all high touch surfaces every day. High touch surfaces include phones, remote controls, counters, tabletops, doorknobs, bathroom fixtures, toilets, keyboards, tablets, bedside tables, all these are high touch surfaces. So all such surfaces must be cleaned daily. Clean and disinfect areas that may have any trace of blood or stool or body fluid on them. If a caregiver or other person needs to clean and disinfect a sick person's bedroom or bathroom, he he or she should wear a mask and disposable gloves prior to cleaning. This is very important in the case a caregiver is carrying a COVID positive person. Now let us see the don'ts for corona positive person. The first thing is don't panic. You should not get panicked and go outside. You should stay home and contact your medical practitioner or healthcare worker or your helpline number. Do You should also avoid close contact with any other person or pet. You should avoid touching your eyes, nose, and mouth with unwashed hands. Before, in case you need to or want to touch your eyes, nose, or mouth, you must wash your hands first and then touch it. Then avoid sharing personal items like mobile phone, dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. These personal items should not be shared with other person at your home. Otherwise, they would also be infected with coronavirus. Do not spit if it is urgent. You need to urgently spit in wash basin or tissue and flush properly. Don't take antibiotics or other medications without a registered medical practitioner's advice. So far, there is no research says that antibiotics work on coronavirus, so it is futile to take antibiotics. And if your medical practitioner decides that it is needed, then you can take it only on his or her advice. Now let us see a video which will tell you what to do if you test positive for COVID-19. So let us see the video. So friends, in this video, all the points for corona positive people are summarized. This is really an informative video, and all the necessary steps that a corona positive patient should take are summarized in this video. So now let us see the precautions that you should take during home cares. Number one, the ill person should stay in a separate room. If this is not possible, then keep maximum distance from him or her. So if your room is a small, then at least 1 meter distance is a must, because in many parts of the world, people live in a small room. So at least 1 meter distance is necessary. Otherwise, you should maintain at least 2 meter distance between two persons. Provide good ventilation in the room and shared spaces, and open the windows. And if possible, And if it is safe, then you must keep your doors and windows open for at least 2 hours daily. And the ill person should wear a surgical mask as much as possible. Surgical masks are very useful as they stop the spread of virus from the ill person, and in particular when not alone in the room and when minimum 1 meter distance from others cannot be maintained, then wearing a surgical mask is a must. So also, visitors should not be allowed in your home. If you are COVID positive, no visitors should be allowed in your home. For single caregivers with no underlying medical conditions. So there must be not more than one caregiver because the chances of getting infected will increase. So there should be only one caregiver who has no underlying medical conditions, means other symptoms like diabetes or hypertension or respiratory disease. So the caregiver should be fit and fine, and he should not have underlying medical conditions, and preferably single caregivers should be there. And the caregivers and other members should also wear a surgical mask while in the same room with an ill person. It's very important that all the person in the home, including the caregiver and other members, should wear a surgical mask while in the same room in which the ill patient is there. Further, there should be separate dishes, cups, eating utensils, towels, and bed linen for the ill person. And the surfaces frequently touched by the COVID positive person should be cleaned and disinfected at least daily. So, so caregiver and other members should also not touch their mask or face during use, this, during its use, and they should discard the mask after leaving the room and wash their hands afterward. This is very important for caregivers. And the dishes, cups, etc., towel, bed linens of COVID-19 positive persons should be washed with soap and warm water, and they should not be shared. These precautions are very important to be taken during home care of COVID positive person. And let us see further precautions. Everyone in the home should wash their hands with soap and water regularly, especially after coughing or sneezing, before, or during and after you prepare food, before eating something, after using the toilet, before and after caring for the ill person, or when your hands are visibly dirty, you should wash your hands with soap and water regularly. A cough or sneeze should be covered with a flexed elbow or a disposable tissue that is discarded immediately after use. This is very important because droplets may spread and chances of infection will increase. The waste from the ill person should be packed separately in tightly closed bags before disposal as per local government guidelines. The wastes include the masks or other disposable things used by the COVID-19 positive person. So all such things should be packed separately in a tightly closed bag and disposed of as per local rules. Let us see what is the home isolation period for a corona positive person. So people with COVID-19 who are cared for at home should stay in isolation until they are no longer able to transmit the virus to others. And as per the existing research, those with symptoms should stay at home isolation for 10 to 14 days and a minimum of 10 days after the first day of developing symptoms, plus another 4 days after the end of symptoms. End of symptoms means no fever and respiratory symptoms like coughing or sneezing or trouble in breathing. And if possible, repeat the test after 14 days. So if you have any symptoms and you are corona positive, then you should stay at home isolation from at least 10 to 14 days. And a minimum of 10 days after the first day of developing symptoms. This is the key rule. And if you have no symptoms, means asymptomatic patient, for them, they need to be at home isolation for minimum 10 days after testing positive. So this is the period for corona positive person for which they should be isolated at home. Now let us see a video which gives you details of the isolation for home isolation for a corona
We get
positive
a lot of
person.
questions from people about
Let us see the video.
COVID-19. Like, what should I do if I get exposed? How long should I stay home? To answer those questions, let's look at a few examples. This is Sam. Sam was exposed to COVID-19 on April 2nd when he saw his great aunt Marion. Since we know it takes between 2 to 14 days for someone who is exposed to begin to show new symptoms, Sam should stay home and watch for symptoms for at least 14 days. Common symptoms are cough, difficulty breathing, fever, chills, muscle pain, sore throat, and loss of taste or smell. Some people may also experience nausea, vomiting, or diarrhea. On April 16th, 14 days after exposure, Sam still showed no symptoms. This means he can now return to normal activities. Now let's look at another example. Sandra was exposed to COVID-19 on April 3rd. When she found out, she stayed home and watched her symptoms. 7 days later, on April 10th, she started coughing. 2 days later, April 12th, she had a fever. People with COVID-19 who have isolated at home can leave under the following conditions. No fever for at least 72 hours. That's 3 full days of no fever without the use of medicine that reduces fevers. And their other symptoms have improved. For example, when their cough or shortness of breath have improved, and at least 10 days have passed since their symptoms first appeared. To figure out when Sandra can leave isolation, we have to look at when her symptoms went away. Her fever went away on April 18th. 3 days later is April 21st. Her cough and other symptoms went away on April 20th. 10 days after her symptoms started is also April 20th. Of these 3 dates, Sandra has to wait until the latest date to leave isolation. The latest date is April 21st. That's when she can return to normal activities.
So friends, in this video, you may have understood how to keep track of the days of isolation if you are tested COVID-19 positive, how to calculate the days for home isolation. So this was indeed a practical video which was very helpful for understanding the period for isolation for COVID-19 patients. Now let us see what to do if you suspect to have COVID-19. So if you suspect you have COVID-19, then number one, don't rush to a hospital in panic, because only on suspicion you should not make panic and do not go to hospital. Number two, try to consult a doctor via phone or video call. Nowadays, video call is very common, so you can try to consult a doctor via phone or video call also. Number three, hear what your doctor has to say about the test. So only your doctor can advise where you need a test or not for corona disease. Number four, and let the doctor decide whether you need to be admitted or isolated at home. So doctor advice is very important. He will decide which type of test has to be done and whether you need to be admitted or isolated at home. Number five, if your doctor advises you to be isolated at home, in that case, stay away from your family and check your temperature on a regular basis. Monitor your oxygen level regularly using a pulse oximeter if you have with you. Better you purchase a pulse oximeter. Nowadays, it is not much expensive. So if you can afford, purchase a pulse oximeter and monitor your oxygen level, which is given as percentage SpO2. And during home isolation, keep sanitizing your hands often. Also keep monitoring your symptoms and consult your doctor daily via phone or video call and tell him about your symptoms. Number 6, if your condition worsen, then inform your doctor or emergency COVID care provider and get admitted to a hospital suggested by your doctor or COVID care provider. So these are the steps that you should take if you suspect to have COVID-19. It is not for confirmed cases. This is only for the suspected cases. If you suspect, if you have some symptoms like that, then these steps should be followed. And don't forget to wear a mask, be a little vigilant, and follow the sanitizing and social distancing norms. This is always very important in current situation. So these are the things that you must do if you have any of the symptoms of COVID-19 and you suspect that you have this disease. Now, having seen all the steps that a corona positive person or or one who suspects that he has corona positive should take, let us see some points of concern of people who are suffering COVID-19. So now the greatest point of concern in that most people who contract COVID-19 have little or no symptoms at all, who are called asymptomatic patients. And such asymptomatic people could spread unknowingly the virus among others. So this is a great point of concern. So all of us must wear mask covering our nose and mouth properly. This is very important. The next concern is symptoms are very common to flu. For example, running nose, fever, cough, congestion, stomach upset. So differentiating between common flu and COVID-19 is very difficult. So this is a point of concern for people. Sometimes people get confused and there becomes delay in starting treatment and condition worsens. So it is an important point of concern. The next point is making difference between them based on symptoms alone is difficult even for medical practitioner. So differentiating common flu and COVID-19 is very difficult even for medical practitioners. Sometimes even test results also are not clear. So it is a very important concern. However, a diagnostic test can help determine if you are sick with common flu or COVID-19. Generally, RT-PCR test or molecular test is considered a good test for diagnosing whether you are suffering from COVID-19. At many places, still it is not so easy to get yourself tested for COVID-19. In many parts of the world, people don't have access to testing facilities. So it is a great point of concern for people suffering COVID-19. So having seen all these precautions and steps for prevention and home care as well as hospital care of the patients or people suffering COVID-19, you must remember that to win the war against coronavirus, we all must wear a mask, wash your hands frequently, and work with social distancing. This is the key rule today. And by adopting these three measures, we can win the war against coronavirus. Thank you.